Hi guys, my name's Ellen, and I'm going to be your nurse today. And this is RN Aware, the hopefully weekly show where I tell you things I wish you knew about coming to the emergency department. Today, I'm going to lecture you on wearing a mask. That's right, friends, it's COVID-19 season still, and you need to have a mask on your face. The first thing I kind of want to do is review a couple types of masks that I have and that I use on the daily, essentially. The first one is the lovely Holy N95. So mine is in a bag because we are reusing them right now. After we use them, they go in a bin and get sent off to be sterilized, and then we get them back. It's great, and I'm not uncomfortable with it at all. So, yes, this is the N95. This is that kind of respirator mask that people have been talking about. This is kind of our gold standard for taking care of COVID positive or suspected COVID patients. There are different manufacturers, so they may look different. Sometimes they're more of a flat front. Ours are the duck bill because they make me look like a duck. So I'm going to show you how I put this on. It tends to go a little bit better if my hair is tied up. So we'll get that up real quick. So this is my N95. Again, this has been worn by me. Has my name on it underneath. And so this is how I get mine on. Is it the right way? Probably not, but it works. So I always take some deep breaths to make sure that it kind of goes in and out. That means I have a good seal. 2 straps, one up high, one down low. I pull my hair up because it actually stops the second strap from sliding down. So typically if I have this on, I also have some sort of head wrap, whether it's the disposable bouffant caps or I have a couple surgical caps that I wear. My glasses, plus my goggles, gown, gloves, the whole kit and caboodle. So this mask goes with like the full head to toe craziness. This is a bit tough to breathe through. Not hateful. It's tough to talk a lot. Mostly because I pinch this very tight up here because I do wear glasses and I want a good seal. So it pinches my nose a little bit. So this is something I wear in like one patient's room. As soon as I come out, I change into my just regular surgical mask. So this one I'm not wearing for too long. Usually like a max of 30 minutes at a time. Maybe longer if the patient is really sick. But this is something I change out of and only put on, again, when I'm with a COVID-19 positive or highly suspected patient. So I'm going to take this one off here. Again, I don't know if you can tell, I handle these by the very ends and the straps. That's how I handle all of my masks, because you're not really meant to touch this part here. So now this mask is ruined because I'm messing with it. It's not ruined, but so you're meant to handle your masks by your straps and the edges, and that's it. I'm going to take my hair back down. We don't need it up for the rest of this. So the second type of mask is the one I actually wear all day long at work. It is the lovely and beautiful surgical mask. Ooh. You can actually buy these on Amazon in 100 packs if you want. You don't need to. Regular cotton mask is good enough. But this is what I wear all day at the hospital. We get 1 per shift. So this one I actually wore for 4 hours yesterday. Since I'm wearing it for this video, I know I'm going to get makeup on it. So I'll definitely get a new one for tomorrow. If I do have like a short shift, like a little 4-hour shift, and I'm back the next day for longer, I will keep the same mask. So again, this is regular surgical mask that I wear all day long. Again, handling by the ear loops, pulling just the top and the bottom, and getting my good seal. So this one's a lot easier to move around in, a lot less constricting than that one is. This one I just wear with my regular scrubs. I don't have extra garb. The only extra thing that goes on my face is I do have glasses that I wear at work. So I happen to have mine here with me right now because I didn't put my contacts in today. So once you get the nose piece kind of really set on your face and a good seal on it, it won't fog up your glasses. I know that's a lot of people's problems is I can't see, I keep fogging up. You just have to get this sealed well so that it doesn't keep going up. Another trick is to put your glasses, now it doesn't work as well with these glasses in this mask, but putting your glasses over your mask to almost push it down to make its own seal. So that works really well actually with my glasses that I wear at work. They're a little bit bigger than this. And I have no problem with fogging at work most of the time. Unless I'm like sweating, which happens. This is the mask I wear at work for 13 hours a day. I do everything in it. I'm, starting IVs, bending over, doing crazy positions, climbing over beds, running codes, doing whatever. I can do it all in this mask. Yeah. So standard surgical mask. This is what I wear at work all the time. It's nice. It's not terrible. But I did get makeup on the inside of it a little bit there. So yeah, this one will go in the trash when I'm done with this video. I'm going to use that later though. The last kind of mask that I have is this beautiful cotton, sparkly pink, very fairy tale mask that my 7th grade science teacher and dear friend Kelly made for me. So this is the one that I wear to go out and run errands. So if I'm going to get takeout or get groceries, or if I haven't worked in a while and I don't have a surgical mask laying around, or the last one I wore was really dirty, I'll actually wear this one into the hospital until I get my new surgical mask. This one's just nice light cotton. Again, I kind of put my glasses on top of the mask a little bit to help seal, but I really like this design because it comes up high on the nose and cuts down. So it's not cutting across my eyes. It's not super uncomfortable, but it does stay up over my nose, which is great. Again, this is the everyday thing. This is something that would be good for the common people who are out walking around. Nice, soft cotton. I can throw this thing in the washer, which I do every couple days, and we'll definitely do after this, because again, makeup. But I'm not a beauty guru, so I wasn't really trying to make this stay. That wasn't my goal here. I want to talk about some do's and don'ts when it comes to wearing a mask or using your mask. So for most of my demonstrations, I'm actually going to use my Pretty Blue surgical mask. My cotton one makes some of the demonstrations a little more difficult. Again, like I said, when you're putting your mask on, you should really handle it by the straps and by the very edges. There shouldn't be a lot of touching in the middle, a lot of petting, nothing like that. Use your straps and use the edges. It helps keep the integrity of the mask for longer. So a couple things that I've seen that made me really want to make this video are as followed. Number one is the nose out. My friends who wear your mask like this, you are doing nothing. First of all, this is amazingly uncomfortable. I keep feeling it move every time I talk. I don't know how you wear it like this. But when you wear it like this, you're breathing through your nose. That's why you wear it like this, because you can't breathe. So you're breathing through your nose. You have nothing filtering the air you're breathing in or the air you're breathing out, which is kind of the point of this mask. You're doing nothing. I understand it gets a little hot in there. Again, I wear it 13 hours a day. Now I'm fogging up my glasses because I'm not wearing it right. You are doing nothing. This is not helping anybody. You need to pull it up over your nose because you breathe through your nose and your mouth. Most people breathe through their nose. So if you have that hanging out, you're not filtering anything. The other thing I'm seeing a lot more of is the infamous, straighten that back out because Lord knows they don't fit it over their nose. The chin strap. Chin strap, not a fan. Now you really have nothing filtering anything. Look, mine's trying to ride up and stay in place. This is not helping. If you're going to buy a whole box of these masks off of Amazon and wear it like this, just take that whole box, take it to the nearest hospital and donate it, because you're not helping anybody with this at all. If you're going to buy a mask, spend money on masks, put them on correctly, or else there's no reason. This is really not helpful. The other thing I'm seeing a lot of is people who typically wear their mask correctly, but all of a sudden we've got a phone call. To make sure we're heard, we pull the mask down to speak into the phone. Why? Why are you doing this? All you're doing is exposing yourself and everybody around you. Put the mask on. They can hear you through the mask. You can hear me just fine. I promise. Another thing I see a lot of is if people are having a hushed conversation and one person didn't catch what the other person said. I'm going to take these off so they don't glare in my light. So they lean in and pull their mask down so they can mouth it better, right in each other's face. So not only have you closed that 6-foot social distancing gap, but now you've removed the filter too, to make sure your plague-infested breath can pierce directly into my eyeballs. Just keep the mask on. It's not that hard. I know a lot of people say, I can't breathe. I feel like I can't breathe in the mask. I'm going to be really honest with you. You can breathe in the mask. It's your anxiety. You're feeling your breath on your face, which is not typical, and it feels very enclosed. You have to kind of think through it. Focus on breathing slow, deep breaths, nothing crazy. You don't have to do weird Lamaze breathing or anything. You just have to do mind over body. You can breathe in the mask. You're also not breathing in your CO2. I don't know where the heck that came from, but that's some malarkey, because if we were just rebreathing all our CO2, every single doctor, nurse, tech, housekeeping, food service, radiology, OR staff, house supervisors, managers, all of us who work anywhere in the medical system would be dead by now because we've been wearing these nonstop since March. You're not rebreathing your CO2. You're fine. The whole point of this video is to just remind you to keep wearing a mask and keep wearing it correctly. Make sure it does cover your nose and mouth. My last part of this video is a plea to my healthcare brothers, sisters, both and neither. Please put masks on your patients. Whenever they're going to imaging, going to their inpatient bed, or just walking to the bathroom, make sure they have a mask on. The same goes for their family members. Make sure that mask is on their face. Far too often recently, I've been seeing more and more people out of their rooms without a mask on, and it's starting to scare me. We cannot become lax in our practices. We need to continue to do what we've been doing, making sure every patient and family member is masked. Make sure they have their mask on at all times. I know on the inpatient side, some places are allowing a patient or family member to take their mask off while alone in their room. In my ER, we ask that people keep their mask on the entire stay. Make sure that happens. Don't take a patient out of the room unless they're masked. If you need a mask, come find me. Say, hey, Ellen, Jane Doe in bed 6 doesn't have a mask. Do you have a spare? I will hunt you one down as quickly and efficiently as I humanly can, because I want to keep you safe and I want to keep that patient safe. Make sure they are masked. Long story short, put on a damn mask. As always, take your medications as prescribed, drink plenty of water, wear your mask when you're out in public, and I'll be back in a little bit to check on ya.